Hi, my name is Chris Cleland. I am a certified financial planner with American Senior Benefits, a division of Integrity Marketing with offices throughout New England. We're here today to make a series of videos concerning the 4 topics that keep our clients up at night. They are Medicare financial planning, retirement income planning, estate planning, and chronic illness or Medicaid planning. We hope you enjoy these videos. Hi, this is Chris Cleland. I'm the Certified Financial Planner with American Senior Benefits, and I am also the host of Planning for Your Future podcast with American Senior Benefits. Today, we have a special guest, Dave Pallotta from Care Partners in Rocky Hill, Connecticut, one of the 5 top providers in Connecticut this year for Medicare. And we're going to listen to Dave's expertise and all about Care Partners. You have 4 different plans this year?
So we do have 4 different plans. We're an HMO company. We have 3 HMO products, and for 2021, we're offering a PPO plan to allow for some more flexibility for individuals.
So Dave, tell me, you've been in the business for what, like 150 years?
Myself, no, just since 95, since
That's a long time.
World, yes.
That's a long time, 25 years, right?
Yeah, so I've been on a couple carriers. I've been with Physicians Health Services, which turned into HealthNet. I've been with Connecticut as well, and now with Care Partners product. And it's amazing how innovative this company really is, and the site that they have to create a product, it's different than where I've been in the past. Mm-hmm. And I've really seen that on putting the member as the focal point of our product.
Sure. So talk to us a little bit about the organization, how Care Partners came to be in Connecticut, because you guys are a fairly new venture here for this great state.
That is true. So we're entering our 3rd annual enrollment, and we started in 2018. We're a joint venture with Hartford Healthcare. Hartford Healthcare is the backbone of our network. We do have other hospital systems in place, other provider groups as well. Sure. But Hartford Healthcare is our joint venture product, our joint venture partner. Thank you. Our joint venture partner for the Care Partners of Connecticut product. Mm-hmm. So I said I'm a Tufts Health Plan employee. Tufts is based out of Watertown, Massachusetts. Yep. They've been in the Medicare business for many years now. Over the past 6 years, we have received a 5-star rating in the state of Massachusetts. They are the ones that provide the administrative back end for the Care Partners product. So we have an understanding and a goal and an objective of being a 5-star plan when we can. Currently, we're too new to rate, but that's our goal and our objective, to be the first in the state of Connecticut. That's
fantastic. I mean, it sounds like you're on a great, you have a great organization backing you. You have a great vision for where you want to take the plan. You have a great partner with Hartford Healthcare. All the ingredients to be a major force in the Medicare industry here in Connecticut and wherever you guys decide to go. What kind of so tell us a little bit about the plans, I guess, and then maybe you can get into the network and how that is all structured inside these plans.
Absolutely. So we offer 4 plans this year. Okay. We're going into 2021. We're an HMO carrier, but we have introduced a PPO product this year. Our 2 most popular plans, we were assuming, will be the PPO plan,
sure,
but our zero premium preferred HMO product, mm-hmm. Which is a zero premium plan. All of our plans offer the member access to their primary care physician at no cost.
That's great.
Some of the things that we strive in that carrier relationship and sure. that integrated care model is preventive services. We want those individuals to have access to their primary care physicians yep. at no cost. We offer things like a 0 cost for vaccinations. So the plans really are geared toward health, wellness, centric around that member and helping them to stay healthy and have great access to healthcare.
I think one of the things that really interested me with the Care Partners plan is that one of the ways to keep costs down in any type of Medicare situation is to keep the beneficiaries healthier, right? And it seems to be the common theme with Care Partners and a lot of the different carriers that wellness is a huge factor. And if you can manage the care through the life cycle of someone and all the the idiosyncratic type illnesses and challenges that we face as we go, it seems to work out better for everybody. And I see that as a common theme with Care Partners. Is that how you guys are addressing that vision?
Yes, absolutely. Preventive services, if you think of being able to manage someone's health care, investing in that individual, providing those services, access to the primary care physician at no cost, providing vaccinations at no cost under our plan, offering things like silver sneakers to all of the benefits that we have, all of the plans that we have, really does strive to make that a better relationship. We want those people to see their doctors. In fact, with COVID, we have waived copays for our not only primary care physicians, but specialists as well, labs, tests, diagnostic tests throughout the remainder of the year, because we want those people to go to the doctor.
Right.
Because in the long run, it's a benefit. It's a benefit for the company, but it's also a benefit for that member. And if we're able to keep them healthy and have better access to health care, it's ultimately going to make for a better return. We want to move away from a fee-for-service mentality.
Right.
We want a risk-based offerings and be able to manage that care, and by doing so, you need healthy people to do that.
Right. So, in looking at the other plans, and I think there are four, I think maybe five carriers in Connecticut that are considered the major players. I know that some of them have. I guess I'll call them accessory benefits, be it dental, vision, over-the-counter, all of that stuff. How does Care Partners approach that type of plan, of benefits, I should say?
Yes, those extras are
the extras.
The extras. Everyone does appreciate those. So we've added over-the-counter benefit to now all of our plans offer an over-the-counter benefit, allowing people to be able to have a little extra each quarter to be able to spend on those medical, unprescribed medical necessities.
Right.
But in some of the differences between ourselves, we offer a dental package on all of our plans. Our zero premium HMO, our preferred HMO, has a $1,500 dental benefit that comes with a zero premium plan. So, and the new PPO actually has a $1,000 dental benefit with that. So we utilize Dominion National as our carrier, so that people have great access to quality dentists, and being able to have that is a strong piece.
So the richness of the plan is really has taken you've taken it almost to another level this year. From previous years, from the previous 2 years up into the competitive stratosphere, if you will, with the other carriers. With the other carriers out there, in Connecticut being a kind of a smallish market, right? We don't have, how many total Medicare recipients in 700,000 folks?
It's in that range.
Folks, so there's quite a competitive area, if you will, for people to want to choose. I mean, we're giving them some massive choices here. Among different carriers, and you have to be kind of top of the line to be able to get that business.
Yeah, very true. And about 50% of that market share is in the Medicare Advantage space, or the Part C plans, as opposed to traditional or original Medicare with supplemental coverage to enhance their plans. We offer the ability for people to be able to have a wellness allowance on our preferred HMO, which is a $175 allowance to be able to put towards a Fitbit or a Pilates class or acupuncture or senior driving class. So there's a number of abilities for it to be used, but it's, once again, it's putting that person out there, giving them the tools to be able to help manage their care and be able to be healthier individuals.
I know we talked a little bit off camera before we started this about some of the new rule changes, and one of the ones that came to light very recently was that there is no more 5-star plan, health or drug PDP plan, prescription drug plan in Connecticut. It used to be Anthem. They have dropped to 4.5, and so now there was a loophole. And why don't you tell us how that whole thing worked?
Yeah, certainly being a 5-star plan, as we are in Massachusetts, and the roots of our plan, they have the ability, it's called a special election period, when you have a 5-star plan, to be able to offer that year-round to people. So if you're a Medicare Advantage member or a traditional Medicare user, you have the ability to join that 5-star Medicare Advantage plan or prescription drug plan at any time during the year. So there's a huge advantage to that company to be able to offer that.
Right.
One of the other advantages is that the reimbursement levels that you get back from CMS, the Center for Medicare and Medicaid Services, is at a higher level. So there's a strong effort for us to be able to reflect what we do in Massachusetts here in Connecticut.
Right. So previously, just so we're clear, if I was in a Medicare Advantage plan and I wanted to get out, I could switch to a 5-star prescription drug plan and then add a supplement onto that and be able to go back to original Medicare with that supplement. And in previous years, and I cannot do that this year in Connecticut.
Yeah, unfortunately, that has been taken away. So right now we're in the annual election period, which runs from October 15th to December 7th, and people are allowed to make changes to their plan. They can go on to Medicare Advantage. They can go on to traditional Medicare with a prescription drug plan that goes into effect on January 1. Mm-hmm. Last year, Medicare has allowed for the OEP, which is the Medicare Advantage open enrollment period, which allows people to switch from a Medicare Advantage plan to another Medicare Advantage plan or back to traditional Medicare and a prescription drug card if that's what they choose. The other only option that someone has that even if they've been on traditional Medicare for a number of years, if they're brand new to Medicare Advantage, so they've just started their Part C and they decide 6 months later that it's something that they're not comfortable with, they do have a 1-year kind of an out clause or a regretful clause to be able to use as a special election period to say, no, I don't want. But after that, we hope to be the 5-star plan in the future here in Connecticut.
That'd be great.
So that other companies...
so other companies can switch to your plan. I mean,
well, I didn't want to go there, but you know,
I'll throw that in for you.
I appreciate it.
I throw that in for you. So in now we kind of outlined, there is a wide array of plans out there. Why is Care Partners the better choice this year?
You're right. There are very many plans. Some companies offering as much as 6 zero premium plans. We've tried to simplify life.
I know my head hurts from having to go through all that certification for all those plans. But you're absolutely right. There is a mix mash of things out there, and you guys are a very clean, nice, intelligent option in the Medicare space this year.
We tried to keep things as simple as possible. More is less is more in this case. Yeah. And it's not just for the consumer, but Connecticut is a strongly run broker-driven marketplace. About 75% of business in Connecticut does run through a broker.
Right.
And the brokers appreciate the keeping things simple, as you said, and
Right.
because there is a lot to absorb and comprehend. That's why our prescription drug plan is the same across all 4 platforms. We don't make it so confusing that it's a challenge to understand what the company is trying to put out there in front of the clients. And so members can easily identify the difference between our 4 plans as opposed to trying to understand what those differences are.
So one of the things that always comes up in the conversation is network. Who is an ideal client for Care Partners for 2021?
Care Partners' ideal client, the easiest to identify with somebody that is currently utilizing Hartford Healthcare.
Right.
Hartford Healthcare providers have the ability to be able to communicate and work closely in this integrated care market with other Hartford Healthcare providers, but also other partners that we have. Sterling Physicians, Prospect Medical Group. There are some larger provider groups that also augment our network. We've, in fact, just expanded our market share of our service area into Middlesex County and have recently added Middlesex Hospital and the Middlesex Physician Group into the network so that we are now in 7 counties, Fairfield being the only one that we're not currently in.
Okay, great. So what's your vision? What is not necessarily your vision, but what is I'm sure you're part of that vision. What is the vision for Care Partners in Connecticut going forward? Are we staying in Connecticut? Are we going to progress? I mean, maybe I'm talking out of school here a little bit. But let's just talk about Connecticut. In Connecticut, what is the ultimate goal here for Care Partners? What does Tough have lined up for us?
So if we look at last year, we ended up getting 15% of the market share after AEP. So that put us in 3rd place. So if we're a carrier that was only in 6 counties,
right,
we don't have a current relationship with Yale Hospital System, and yet we were able to get 15% of the market share, which put us in 3rd place, is beating out 3 other carriers is a real strong statement.
Right.
We expect to be at about 2,000 members by the end of this year, and after AEP, hopefully we'll double that number, and really entrench ourselves here in the state as a quality value option with an integrated care market, integrated care model for the members to be able to access great care. Hartford Healthcare is a fantastic partner that we have. Their goal is to be within 10 miles of any one of their members, and they're closing in on that right now. So, having them as a partner is just fantastic. Their growth and development is seen across the state.
Yeah, I think like we talked about before, it seems like their wellness model and being able to follow somebody from cradle to grave, if you will, is really excellent. The people that I have talked to that are in that system, they can kind of take their foot off the pedal and not worry about where they have to go next. They just have to worry about getting healthier, getting better, and enjoying life a little bit more.
Absolutely, that's where our care coordinators come into play, and we have 2 levels of care coordinators at Care Partners. We want people to not feel as though they need to have multiple morbidities, to have someone to help them sustain their health care plan.
Right.
But as you said, someone entering into a hospital in an emergency situation in the emergency room to the point where they're admitted into the hospital, where they're then transitioned possibly to a skilled nursing facility,
Sure.
to then having health care needs at home. We're able to coordinate that through the entire process, taking that burden of that individual having to try to do those things on their own, understanding that we keep all of that in network for them to keep their costs low.
I think that's a real power of Hartford Healthcare and the Tufts Network, is to be able to coordinate all that activity together and bring a great user or beneficiary experience to that member. that is harder and harder to find sometimes these days, because you get 1-800. You're now 87th in line. Your wait time will be 87 minutes. Wait a minute, my arm's falling off. No.
So yeah, it really is. We're a local player here in the New England area. Obviously,
Right.
our roots are in Massachusetts, but
Sure.
they still root for New England teams here. So
even
we're
though
close.
Brady left, we'll forgive him.
Absolutely,
We'll forgive
but I'm a Giants fan myself.
There
so
you go.
I'm all set with that. So when you look at the arrangement that we have with them and with
Yeah.
Hartford Healthcare, it's truly a great relationship that is something that they are really trying to reach out to the people. They build family health centers, and these family health centers are points of access to that member where they can go for preventive services, they can go for blood work, they can go for diagnostics. There's specialists that are all part of those, and they're popping up all over the state.
I see them everywhere I go. Yes.
Mystic just had one that opened up. We'll have a new one. There was one just in Cheshire last year that opened up.
Yeah.
And Winstead has another one that's opening up in the spring. So
That's fantastic.
yeah, it's those points of access, getting people in the ability to access care, not feel as though they have to go to an emergency room to get those things done, but to be able to utilize telehealth medicine. Obviously, with the onset of COVID, there has been a shift in healthcare, and providing people access to their doctors, whether it's physically with them or virtually, has been a strong suit for us.
Yes. So, just summing it all up, I think Hartford Healthcare and Care Partners together, that relationship has created a really strong Medicare plan or Medicare plans in Connecticut, another offering for the folks to choose from. And we hope to see more and more of you. I hope to have more conversations so we can talk more about actually how Medicare works, maybe get into the weeds a little bit about Medicare 101 and some of the tricky stuff that people have to go through to get on the plan, whether they're working or non-working, and Part B and qualifications and all that stuff is extremely worrisome. And frustrating for some people, and bringing someone like you in that has been in the business for 25 years is an expert in going through all the travesties and travails of this stuff would be great. I'd love to have you back.
Absolutely, I look forward to it. Thank you, Chris.
Thank you, Dave. All right, take care.
Thanks.
Thank you for watching these videos. If you'd like to find out more information and contact me or any of the experts here at American Senior Benefits in Farmington, please click on the link below.